Welcome back to InFocus, and it's my pleasure to introduce and welcome to our program for the very first time Mrs. Karimu Byron-Caines. Welcome, Mrs. Caines. It's good to have you.
Thank you so much for having us, Mr. Richards. It's a pleasure to be here today.
And of course, Mr. Rogers, you've been here before, but again, as I mentioned, you're here in a different capacity. It's good to have you.
Yeah, thank you, and truly appreciate it that you would have me on your show today.
Right. Okay, so we want to jump into the National Council on Drug Abuse Prevention. Now, Mrs. Caines, of course, you are the person who is in charge of the Secretariat. Tell us a bit about the mandate of the council.
Sure, no problem. So the St. Kitts-Nevis National Council on Drug Abuse Prevention, the general mandate is to centralize the coordination of the government's response to substance misuse and abuse in the Federation. So this includes policy development, advocacy to address gaps in our legal framework, in our services, and just centralizing the coordination as it relates not only to prevention and treatment that many people focus on because of our name, but also coordinating with supply reduction and control measures as well with the police, with customs and excise, as well as international cooperation.
Now, I mentioned earlier that the council was established in 2000. What factors influenced the establishments of the council?
All right, the government of St. Kitts and Nevis would have seen the need with an increase in substance misuse and abuse and the accompanying challenges that come with that, violence, crime. It was on an uptick, and so they realized that they needed, we needed a coordinated effort to address these challenges, to eradicate those risks or somewhat curtail those risks before it got too far out of control. There were also a number of international conventions as well that required this sort of international cooperation to make sure that we are addressing these concerns, not just in our own bubble, in our own country, because of course there are issues like trafficking, and they're very smart with those statistics as well. So it was an effort locally to address our concerns here while also addressing international conventions that we are signed on to.
And so that was the situation back in 2000. What is the environment now? And the ACP, I'd like to weigh in on as well in terms of from a law enforcement perspective. What is the environment right now?
Okay, thank you for that question. Slightly different to 2000. Yes, in 2000, when it was formed, it was considered that there must be a council to guide and to help with the upsurge in substance abuse. Today, we're seeing the advent of lots of different types of substances, and this is no different with alcohol. Alcohol is one of the substances that is worldly abused. So we're seeing the advent of different types of drugs. We're seeing the advent of different types of narcotics, but marijuana is very prevalent, where we have things like crack cocaine, and we're seeing lots of synthetic drugs. And this would be this way because of cultural change, not just for our people, and the migration of different ethnic persons, and would not dare to mention who, but these are what are changing the scope of things on the island of St. Kitts and Nevis.
So, Mr. Richards, I would share, based on what Chairman said, that it has become extremely complex. Back in 2000, we were more focused on a more traditional approach, traditional substances, alcohol, marijuana, and the supply control side of it. But with these emerging complexities in drug use, and I think a few years ago, through the OAS, we were able to do a training on new psychoactive substances for police officers, scientists, and customs officers. And when the trainer came at that time, it was well over 2,000 new psychoactive substances. We have children exploring with lean, with getting cough medicine off of the shelf and mixing it with different Jolly Ranchers and Sprite to create an effect. And this is being publicized through music and social media influences. So it's a lot more complex today than it was back in 2000. So it's continuously evolving, and we have to evolve as well as much as we can as the landscape changes over the years.
Right, because I was going to ask about that in terms of social media. I know TikTok in particular, they have these ridiculous, I call them ridiculous, challenges that could really encourage self-harm.
Yes.
And a person seems to readily embrace and just carry out what they say without understanding the consequences.
Right. And we find that a lot with our young people as well, because they're the one who following these TikTok trends.
Yes, that's correct.
I cannot remember the name of that substance, but thank God I don't think it is here yet. We're seeing it all over TikTok when people take this particular substance and they're just stuck in a position for an extended period of time. And for them, it's fun. I don't know how. But it's not every trend. We encourage our young people that they need to be following. Be informed, get the information, make wise decisions.
And so how would you counter that? How would you address the influence that social media has?
On our young people in particular, I mean. Okay, so the National Council on Drug Abuse Prevention, we do a lot of collaboration with the Ministry of Education, because that is one of the easiest places we can go to reach our nation, future leaders. Most recently, we would have built upon our Living Above the Influence primary substance use education and prevention program. And so this program that encourages life skills and social skills, so we're talking about pro-social behavior, decision-making skill, goal setting, developing self-worth in yourself. We send those type of messages throughout the schools. We start as early as preschool, as a matter of fact, because we were able to develop a program targeting our 3 to 5 year olds, and we educate them in this area at their level.
Right.
Of course, it's at the target level of the age group. And so we're doing as much as we can through those programming, through our social media postings, and every chance we get to go to various groups and organizations to present the message, we are present.
Okay, I'll come back to that in just a bit because there are a number of follow-up questions I'd like to ask. But ACP, let me come back to you, Mr. Chairman, and talk to us a bit about the council and how it's structured and what your role is as a chairman.
Okay, thank you again for that question. Just recently, in 2023, I was named and nominated for chairperson of the council, and I'm grateful for that. With a 3-year term, so my term ends on the 2026.
To be extended.
But how it's structured based on law, you can be reappointed. So I'm still looking forward because I've been working with the council for many, many moons. All right, but it's set up with a chairperson, which is myself. Then you have a vice chair, and then you have a representative from the Attorney General's office. Then you would have permanent secretaries from several ministries. You have Ministry of Sports, you have Ministry of Health, you have Ministry of National Security, and those can either be the permanent secretaries or their representative.
Senior representative.
Right, senior representative. Then you have the Commissioner of Police or his representative, the Controller of Customs or his representative, Commander for St. Kitts-Nevis Defense Force, and
Prime Ministers as
the Prime
well.
Ministers, yeah, designated. And we have, yes, represented from the Bar Association and also from the
Medical and dental.
Medical and dental, and then we have the councils, Christian councils, both for St. Kitts-Nevis, somebody represented from that area. And this comprises, it's about maybe 19 or so different persons involved, and we do have meetings based on our regulations, and we do have that meeting once every quarter. So you're looking at 4 meetings. But of course, if there are emergencies, then the council, my job is to collaborate with the Secretariat, the director, and inform that, look, we're having challenges and we need to put an emergency meeting. All right, and so my job is basically to help guide, ensure that the Secretariat carry out the policies of the government and of the councils, and ensure the day-to-day operations that we function as a council.
Now, you mentioned that you've been with the council for many moons. Just to quote you, how does your career as a police officer help to shape your perspective on the council and the work that it has to do?
Excellent question. Chairmanship is not an easy task. It is an administrative level, and for me, and when I say many moons, I was the commissioner's representative for over very close to 2 decades. So I have been working with the council as the police rep. So I understand the work, I understand the path in which we seek to go from where we were, where we are now, and where we want to channel our endeavors. And being a police officer, and a very senior one, I am in the administrative role at the high command level. And here I am a part of making policies, I'm a part of making critical decisions, and that has prepared me tremendously to take up the mantle of being the chair, because it's a similar role, just in one deal with substance abuse and one deal with law enforcement otherwise, but that has really helped me tremendously to take up this mantle.
If you could comment, Mrs. Byron-Caines, on the work that's being done by the council and how it filters down to the Secretariat to carry out its mandate.
Right, sure, no problem. So as he rightfully stated, there are a number of senior level officials that make up the council, which is somewhat of the advisory body for the Secretariat. So through these regular meetings that we have sometimes some key partners who come in and share critical information related to the field. From those discussions, the council will then make recommendations to the way forward. And now at the Secretariat, we have to figure out how we'll get these recommendations implemented, whether it is to send advocacy letters out to the higher authorities as it relates to the legal framework, or most recently, again, developing our national drug policy, which was approved last year. So as they said, we really need to push for a national drug policy. The Secretariat takes that recommendation and we figure out how we can budget, how we can coordinate to make that possible. And so far, the team that we have at the council, they are tremendous to work with, because although the Secretariat is a team of 4, including myself, we often can lean on council members as well to come in and assist us with actually implementing some of the recommendations that are brought forward.
Can you give us a brief sense of what's in the policy?
Oh boy, so the policy consists of 5 main pillars. We have that we felt needed to be targeted in order to address our substance use situation here in the Federation. So the 5 main pillars includes institutional strengthening. So under that pillar, we are looking at what is the capacity of our force, whether it is within the council but also outside of the council, our partners, our stakeholders. Are they adequately trained? What type of training is necessary? And so we have identified areas where we can develop the human capacity of our national ambassadors or frontline workers to carry out the various roles in health, in social services, in the police force. The next pillar is, in short, demand reduction, but it's prevention, treatment services throughout the Federation. So in the policy, we would have addressed some gaps. And one of the main things that came out of that is the need for a national prevention program, because what we find here in St. Kitts is that health is doing something. Maybe council is doing something, social services is doing something, somewhat fragmented. And so out of that policy that has been approved, we are to develop a national prevention program that brings more cohesion and coordination to our prevention efforts in St. Kitts and Nevis. So that's one of the main key factors coming under that second pillar. The third pillar is supply reduction and control measures. This is where we work alongside the police and customs officers to ensure that we are up to date with best practices of the new trends that they should be looking out for to make sure that they are adequately equipped to carry out their work. We have research, monitoring, and evaluation. We still have a lot of challenges in that area, because unfortunately, I'm hoping and praying that this changes in the future.
It's a Caribbean thing.
It's a Caribbean thing. Some of them are doing better than us in this area, but we're not a data-driven society. But I strongly believe in evidence-based approaches, because it gives you a more directed approach to tackling situations. And many times we think we have an idea, and we don't. So So research, monitoring, and evaluation, and finally international cooperation, because we cannot do this alone. So there's a lot of international collaboration that we carry out in that policy.
And actually that leads to my next question in terms of some of the key partners that the council has. What does it work with? And we'll probably keep it mainly to the local audience in the meantime, local organizations here. Who are they?
Okay, we would have mentioned we would have mentioned that earlier. Mr. Richards, so we said we collaborate with the Ministry of Sports, we collaborate with the Ministry of Health, importantly, because when you have to speak about rehabilitation, it's underneath the Ministry of Health. We also collaborate with the Ministry of Culture, National Security, of course, our key. We falls within the scope under that ministry. And the police, of course, Defense Force, the customs, importantly. And I think those are some of our key partners that we work with. And I must say that everybody has been on board. They have been doing the tasks that we asked them to do. And because it's a team effort, and without them, our partners, we would not be as successful as we are, because our secretariat is small, but we're tallow. Yes, but we do a pretty good job with a small staff. That's why I would play here for more.
But to add to what the chairman also said, apart from the government organizations, we reach out to a lot of faith-based organizations, community groups, where we somewhat go out to share our message with them. And they have been very receptive. We continue to open up to the wider population. If you see a need, reach out to us. We have worked closely with even some local individuals who have supported us. We had Sajiko supporting us with our training in prevention and treatment program. So there are quite a few persons who come on board, and we also welcome additional support as we move forward.
Now, you mentioned sports. Does that include doping? Because there are various aspects that would cover under drugs there.
Right. So I know there was some doping activities or correctional measures that were in place recently. So when we partner with them, when they were rolling out that, I think it was a policy that they were developing, they would join us in those efforts, and we were able to provide information and recommendations as well based on the direction that they were going. So we also have a representative for the Department of Sports on our council who gets to give input for the needs of the sporting arena as it relates to substance misuse and abuse.
Right, and of course athletes are vulnerable also to, as you mentioned, being targeted for recreational drugs and so on. So that of course will affect their performance as well. Okay, now an important part of the job of the council, I believe, is prevention. And I would just like to quote a scripture. It says, "A prudent man foresees the evil and hideth himself." So how does the council coordinate activities in the effort to combat and deter the misuse and abuse among the local population? And of course, the local population is a very large scope, as you mentioned. You're talking about adults, you're talking about children.
Correct. All right. So there are a number of activities that we are currently employing. When I first got on board, I felt like we were kind of, somebody called, we're there, we're here, we're running on an ad hoc outing fire kind of approach. COVID had its challenges, but it also gave us an opportunity to sit back, breathe, and strategize a little better. So during that period, what we started doing is standardizing our programs, targeting special populations. And so during that period, we would have developed a number of standardized programs, whether we develop them locally or with the assistance of international programs. And we are currently implementing. So I mentioned earlier our preschool program. It's a 3 to 4 sessions program, talking about healthy bodies and learning about your bodies, how to take medicine targeted to them. We mentioned the primary school as well. We are finalizing a program for adolescents. We have done mental health programs in collaboration with the Mental Health Treatment Center. We also facilitate annually the 8 stages of change treatment program in His Majesty's prison to support the treatment and to reduce recidivism among our inmates once they are released. So there are a number of different programs that we have standardized and really trying to implement across the board in our federation in St. Kitts and Nevis.
Mr. Chairman, are there any emerging trends in substance use and abuse among youth adults in recent years that warrant concern? And you touched on some of them earlier, especially as you consider synthetic drugs.
Yes. Yes, okay. And like you said, we would have touched on that earlier. With the advent of social media, the internet, and wide open travel and migration of different persons, we have seen changes where, like we said, alcohol and tobacco plus cannabis were the it in terms of substance abuse. But now we're seeing at our ports of entries, both airport and seaport, where persons are bringing in or importing ecstasy and other MDMAs, methamphetamines, etc. And they're also, well, the director would have spoken about lean, right? And basically lean is a mixture of over-the-counter medication mixed with Sprite, and they can't give themselves a high. But we're typically concerned about the ecstasy and the methamphetamines because these are drugs that are used for well, it could be date raping, it could be for speed, because that's what ecstasy is called. And we know that we have exposed ourselves with various type of clubs, and the persons who perform at those clubs these are the drug of choices that we use, and of course none are local people. So we are specifically concerned about that. Law enforcement, as a council and Secretariat, we are working tirelessly to educate people, because some persons doesn't know the effects that can lead to them and their family, and this would interrupt lives, interrupt your family, your children learning, and job security and so on, because if you're under the influence consistently. So our Ministry of Health would have to get involved, because these persons would require treatment at our medical facilities. So law enforcement is doing best that they can. Training is critically important, so that law enforcement through Customs, Defense Force, and even our port security would be aware of the dangers and be aware of what they looks like, so that they could identify them at our ports, so we could stamp down on the importation. But it's a challenging process, because these drugs can be disguised as normal is a medication or vitamins. And if you pack the whole 200 plus in a bottle, and it says vitamin C or D and sealed properly, you just probably would not know. So, but we're getting there. We have seized quite a bit in recent times, but we know that several has passed to our ports by many means.
And just to add a bit to that as well, some of the additional trends that we're seeing is the increase in edibles, especially among our younger population. I believe in our more mature as well. And we're seeing packaging that very attractive to our young people as well. And so we have the conkers, we have the drinks. And it's very important. There was a situation that I was familiar with. An individual went to a particular store looking for soursop drink, bought the drink, thinking it's soursop drink, drank the entire bottle, had to be rushed to the emergency room at the hospital. So these are some concerns that we have as it relates to edibles. We have the gummies, the corn curls. So it's very important for persons to read those labels to know exactly what you are consuming, because we, as someone may be able to handle some of these edibles, it may not be the same for others.
In the case of the soursop, the person who drank the soursop drink, was that an accident, or did he intentionally go to see?
It was not intentional. He went strictly for a soursop drink. No idea that it was laced with marijuana.
So I would imagine, Mr. Rogers, that the charges against the person who would have sold that drink, is that covered under the law?
Yes, once the evidence to the contrary it can be proven, yes, of course, we have areas that we can charge those persons with.
Yeah. And also, Mrs. Byron-Caines, in terms of the training, now it's important, that, as the ACP mentioned, to be able to identify them when they see them in terms of law enforcement, customs, etc. But also the symptoms, especially for the health experts, they must be able to understand and recognize that these may be the possible causes and test appropriately, which will help with the treatment.
Correct, correct. And so those are some other areas that we focus on, but we still need some work
Yes.
in collaboration with Ministry of Health to get those messaging across as well.
And just to add to this, because we may think that marijuana, we have recognized that our local persons prefer the different strain of marijuana. So what they do, they're bringing in marijuana from the US. I will not mention the specific state, but from the United States. And their seized customers doing an excellent job in season and detecting and in season, but they're bringing in that type that carries a larger percent of the THC, which is responsible for the high that they're looking for. And specifically, we see a lot of this around Christmas time or music festival time or whenever we're going to have big events. They want to enjoy that type of marijuana. So that is, again, is another trend and not specifically leading to the local grown marijuana.
We have a whole section on marijuana, and I think this would be a good time for us to take our first break and continue that discussion, because, of course, marijuana, as you mentioned, is something that we have known, we've grown up with it, and we have considered, as you mentioned, alcohol and tobacco. Marijuana has always been there as well too, and of course there are some emerging trends that we need to discuss with that. And so this is a good time. It's the bottom of the hour. We'll take our first and probably our final break, because I think this engagement is very interesting and we need to get as much in as we can. Okay. Stay right there. We'll be right back with more In Focus. Welcome back to In Focus. We continue our discussion with the Director of the Secretariat for the National Drug Abuse Council of Prevention. That would be Mrs. Karimu Byron-Caines, and also the Chairman for the Council. That would be Mr. Travis Rogers, and of course he's an Assistant Commissioner of Police. We can move into discussion about cannabis at this time. There are a few more questions I have, but I want to touch on cannabis. Has there been an increase based on research in the use of cannabis in St. Kitts and Nevis?
That's a definite yes. And I want to look at it in two ways. Yes, it was prevalent before, but before the advent of the decriminalization. And some persons now are thinking it's legalized. So you can see it visible that people are just walking around with their marijuana spliff or marijuana cigarette. So you could say, yes, it's increased, or it was being used, but it was being done undercover. Mm-hmm. And what we're seeing is the usage by females, strangely. Females are walking around like the males now with spliff in the mouth. They're going to the beach and the strip. They're sitting down in little groups and having smoking, just tirelessly. So overall, for statistically, yes, we're seeing an increase in the use of marijuana.
You want to add something?
Sure, it's just have become a lot more visual. It's in our faces now. Mm-hmm. As it relates to the statistics, though, the specific statistics, unfortunately, we would have, we did a secondary school drug prevalence survey back in 2013, somewhat outdated, and we're hoping to do a new one to see exactly how many of our students are using various substances, not only cannabis, but alcohol, tobacco, the synthetic drugs. Back then in 2013, before it was decriminalized, we had a very large percentage. I want to believe it's about 60-something% of our students would have indicated some use of substances.
And that includes first time, just try it. And
That includes first time. But for regular use, it was near 40%. Experimentation or, around that. So I would really like to see in the future what it looks like now. Because I want to believe after the decriminalization, and we're seeing it so much in our faces now, what those numbers look like.
now, of course, with decriminalization, there was some guardrails that were placed in the legislation, and one of them in particular that I want to mention is the smoking in public. Okay. But Mr. Chairman, you just mentioned, of course, that you could see persons walking around with a joint, and I want to point out that the legislation does not just speak to cannabis, but it also includes smoking, whether it is vaping,
yes.
Cigarettes, tobacco, cigars, all of that is covered in the legislation. So while the cannabis use was decriminalized in certain areas, of course, there are the guardrails that were put in place to protect the population still, because the large majority of us would prefer not to use any sort of substances at all. And so, can you tell us a bit about then what is in place in terms of preventing the prohibition of smoking in public as it relates to the law?
Okay. First of all, public smoking is a no-no. It's prohibited. One should not be in the open down vast in public places, and public places is wide, vast. Schools, bars, businesses, well, such as banks and anything that the public have access to. But what we have done is to create within our laws designated smoking areas, and that's Act was passed in, I think, 2023. This give business persons who owns public bars or any other type of lounges the ability to apply for a license to have a designated smoking area, and that area is assessed by the ministry, and that is the CMO, and then should be consulted with the National Drug Council, so that we give approval to the specific area, and then that areas must be marked clearly at any event that indicate that this is your designated smoking areas. Other than that, you cannot smoke nowhere in the public. If you're caught smoking in the public, a ticket can be issued or may be issued, and that ticket is $500. If you fail to pay the $500, you can be given a 20-hour community service, and if you further don't adhere to that, then you can be given 5 days in prison. So we give all the options of paying before you become a criminal offense, right? So it's up to you how you want to deal with that, but the legislators has put all of those in place to ensure that we adhere to this, because we do not want people going around blowing all the smoking persons. And just like I said, the majority of the person does not smoke, they're not tolerant to smoking, because we have persons who are affected health-wise with asthma. And it's clear, even at music festivals, the majority of the persons who are affected and go away from themselves, the person who are asthmatic. And these are persons who are just there dancing, maybe have a little alcohol, but not smoking. And because of the smoke, that they are affected tremendously and have to be dealt with our medical services.
Yeah. So Mr. Richards, it's about balance. We want to respect everybody's rights and everybody's tolerance. The laws are there, especially for religious purposes. It's part of your faith. The laws have been provided for that. I'm someone who suffers with respiratory challenges as well, so I know exactly firsthand what Chairman Rogers is speaking of. Let us respect each other, and I think it's important for us to stress this. It is not legal to smoke in public spaces, and I really hope people hear and share this message, because for me it is really out of control, and I know when the police is ready to enforce and give those tickets, I hope it's not a cry, because they're giving enough time for education and for you to be aware of the law, that it is illegal to smoke in public spaces. And while we are on that as well, I wanted to bring some more clarity to the cannabis law, because I think a lot of people are really, really not too clear at this time. And so there is an online link, the Cannabis Clarity, SKN.com. So that's https://CANABISCLARITYSKN.com, that provides educational material related to our law. And I encourage everyone to take a chance. It's very easy to read, nice graphics and everything to follow. And that's something that we have been doing in our council as well. We would have shared it on our social media pages. In all of our standardized manuals, we actually copied these informational, I call them slides, into our manuals. So those who are actually facilitating our programs are familiar with what it says. And it's time that we really respect each other, and so that we can move forward in a more safer and healthier and unionized somewhat society as it relates to that.
Mr. Chair, Mr. Rogers, the director, Mrs. Byron-Caines, just mentioned it in terms of respecting each other and having that education out there. I think a question that one may ask is, how much education is enough? At what point will it be that the tickets are beginning to really roll out? And we understand, of course, that there are some persons who are eager for this to happen, and some persons feel that there's been enough time. And so when do we expect to see the type of rollout of this ticketing system?
I'm hoping that this rollout can take place yesterday. That's honestly, it's my honest truth. I think that we have done, through the council, lots of
and
education. We have done a lot.
Chambers.
For our MAGIC program and our national intervention team, they are doing this at schools, at high schools.
And those are police programs? Police programs,
primary schools. I think the ministry have done some.
The AG Chambers
yes,
as well.
Yes, the AG Chamber, and the AG keep coming on some programs, and even if you check his WhatsApp status, he's posting these things all the time, and he's a chief when it comes to our legislation, and I think that we have had enough. We just need to be bold and step out and start to execute, because I mean, we do have the tickets, but we were just waiting on some more education, but our laws have been passed since 2023. It's 2 years now, and I think it's time for us to really execute. I mean, public would cry, but like you said, they have been spoken to, and I heard the cry from our director, and I would like to plea as well the same cry and even more, that smoking is illegal and we are going to nip it in the bud. It's affecting our people, it's affecting our federation, our visitors alike, and we must take a stance now.
Of course, cannabis is considered a gateway drug. Is there any evidence that the criminalization and maybe the more public use of marijuana is encouraging persons to get into smoking, or also to try the other different type of drugs?
Mr. Richards, I know that is something that was promoted years ago, that marijuana is a gateway drug. But there really isn't any research to say marijuana is a gateway drug to other drugs. Some people may use it and go on to use other substances, or they may start with alcohol or tobacco and go on to other substances. But the reality is, having used any form of substances, cannabis, alcohol, tobacco, or others, can have some long-term implications for some. And so people must be aware, be cautious, and responsible in their approach. So I just wanted to correct that. It's not necessarily a gateway drug. There's no evidence to support that, but of course there are other implications that could be, should be considered.
And so I talked about the guardrails that are built into the legislation that was passed in terms of cannabis use for medicinal purposes, and the decriminalization specifically really for religious reasons, or the freedom of conscience, of course, was the main reason. But in terms of the council itself, was it able to, as you mentioned earlier, part of its mandate is to give advice. Was it able to weigh in and shape that policy, shape the laws that were eventually passed?
Yes, we would have had some consultations with the AG chambers and others, and our focus is always to safeguard our people, to focus on prevention, harm reduction, education. And so we were able to contribute in that regard with the AG chambers, health, and there were a few others in that consultation with us. And the council members themselves, they do not hesitate to indicate concerns. And then I will have to put pen to paper and submit to the AG chambers as well, who has been very receptive when we submit our concerns to him. So yes, we get an opportunity to weigh in on these policies and legal reform. And as usual, our focus is people first, prevention, safety, health, and well-being.
Right. Of course, and it starts with prevention. I just touch on prevention that you mentioned, of course, and we want to talk a bit about that living program, the Living Above program that you mentioned. Tell us a bit about that.
All right, so the Living Above the Influence primary school substance education and prevention program, this is something that we started rolling out since 2000. Well, we started working on it in 2000 during COVID, when we were not able to go into schools and we strategized, we came up with a plan, we met with educators and persons in the school to see what are the challenges that we are facing that leads to substance abuse, what are you seeing? And so based on that, we developed this evidence-informed program, 12 sessions program and we had our first rollout, we call it our first edition, in 2022. And we figured we're just going to start running with it, and then as they roll it out, they will be able to tell us how we can improve this manual. And so that happened. We rolled it out. It was implemented in schools across St. Kitts and Nevis, and then follow up, we did a post-mortem with those who would have facilitated and got their feedback on how we're going to improve on that manual. We are happy that the Ministry of Education, through their curriculum development unit, saw it fit after their review and assessment to actually include this into their school grade 4 curriculum. Because this program targets our grade 4 students based on the survey that we would have done that showed us that children begin experimenting the average age by 10. I mean, our grade 4 students are 9-year-old. So we try to tackle those risky behaviors before they take root. And so yesterday and Monday, the 20th and 21st, we launched that program, and we did our training of all grade 4 teachers, all guidance counselors within our primary school in St. Kitts, and we're hoping to do the same in Nevis soon. And so through that prevention program, we are really hoping to tackle some behavioral challenges that we're seeing in our early population, as I said, stop the risky behavior before they fully take root.
Was it difficult to get the program included in the curriculum? Because, of course, we always know and understand, and the CAPSEC was here last week, Dr. Marcus Nato, and we spoke about Aspire. And he mentioned, of course, that the program is not meant to be burdensome either to the students as to the academic studies, or also to the teachers who have to guide that process and also carry out their work grading papers. It could be very challenging as well. What about this program? Was it readily embraced by the teachers, and was it hard to get it introduced into the curriculum?
During our training sessions on Monday and Tuesday, for the most part, I believe most of the teachers and the guidance counselor are eager, ready, they see the need, they were able to identify why this is important. Of course, like any other implementation of something new, there was some resistance, but I can say based on the feedback we had at the end, they are willing and ready because they see the need. And how the Ministry of Education incorporated it is within an already established program, their life skills program that is already being implemented. And our manual only accommodates that and provides the material and the information to facilitate these sessions on life skills and social emotional intelligence and things along that line. So for the most part, yes, there may be some one or two who are somewhat resistant because, you know, some people are receive change differently, but I believe as we go along, it will be more received, and we look forward to the follow-up, because this program is being monitored because we're looking at continuous quality improvement. We don't just give a program and think it's perfect. We don't operate like that. There's always room for improvement, and with the changing cultural and complexities that we face, changes will need to be made. So there's monitoring and evaluation for that, and continuous quality improvement. As a matter of fact, this program received a round of applause at International Demand Reduction Experts meeting, because we would be one of the first Caribbean territories to have a program such as this integrated into the curriculum. So eyes are now on St. Kitts and Nevis, because they are eager as well to have something similar integrated into their curriculum. I'm already sharing the program regionally because it has garnered a lot of interest.
Right, and I was actually just about to touch on that, because let me just mention the name. It's Living Above the Influence Primary School Substance Abuse Education Program. Now, it's been commended by the Inter-American Drug Abuse Control Commission, which is the CICAD, and also the Organization of American States.
They're within the same.
Mm-hmm. Right, right. And so that recognition there is certainly, I'm sure, Mr. Chairman, something that helps to validate the work of the council and the efforts that are being made by persons.
Yes, yes, indeed.
It has been very encouraging, because our work is not always easy. And in this field, you don't necessarily see rewards right away. Mm-hmm. In the helping field, in the health services, social, the psychosocial areas, it takes a while for you to see success, whether it's in behavioral change, whether it is in more acceptance and attendance. So for us to get this type of recognition, especially for our team that work tirelessly to develop these programs, to do the research, to get the information out. The team is very proud of this accomplishment, and it gave us an extra boost in our efforts. So yes, it definitely has made some impact for us.
From the smallest sovereign country in the Western Hemisphere, absolutely, we continue to lead in that area. All right, so we're going to take a final break, and it's going to be a short one, of course, and then we want to touch a bit on treatment and also recovery efforts for persons who are addicted and have substance abuse. So we'll have that discussion next. Stay right there, viewers and listeners. We'll be right back with more In Focus.
If you haven't done it as yet, please do it today. Subscribe to our YouTube page at SKNIS Media for regular updates, live coverage, and even more information on your government. While you're at it, like, share, and interact with our Facebook and Instagram pages at SKNIS Media and SKNIS Info.
Welcome back to In Focus. We continue our discussion on drug prevention and drug abuse, and our guest today, of course, is Mrs. Karimu Byron-Caines, and also Travis Rogers, who is the chairman of the National Drug Council here in St. Kitts and Nevis, and the focus, of course, is on abuse prevention. All right, so as we talk a bit about, persons being addicted to substance abuse, tell us in terms of what can be done to improve recovery services here in St. Kitts and Nevis and help persons to really break that addiction.
All right, so although we don't have a fully coordinated system per se, we have a lot of services, from the mental health services to recovery support. I would have mentioned earlier that one of our challenges is that we are very fragmented, but there are services available through the Ministry of Health mainly. When we are tackling it from a biological perspective, there are agencies like the Community Health Psychiatric Services, where assistance can be sought, or even your private medical practitioner can assist you in that area. There is also the Mental Health Treatment Center, because, of course, there's a relationship with substance misuse and abuse and mental health disorders as well. And so, as it relates to treatment, those are some of the areas that we currently have. As it relates to recovery, there are a lot of, so when we think of recovery, we think of ongoing social support. to stabilize individuals who may have had a mental health or substance use disorder. And so through various social services program, there are a number of support through ensuring comfortable living situation, employment support through Labor Department. Those are very different types of recovery that could be afforded to individuals who may be struggling. There are a lot of services out there. We are making efforts to make that more coordinated so that people can better navigate, because what I find is that a lot of people do not know that these services exist. So we're trying to coordinate in a way to help individuals navigate from the biological support through the hospitals and the community health centers and the psychological support through to the various social services programs that are available to assist them on the road to recovery.
Jump back to what you said earlier, the mental health, the link between mental health and substance abuse. Is that prevalent here in St. Kitts and Nevis?
I like to go on data, as I said earlier. And unfortunately, in St. Kitts and Nevis, we do not have data to confirm. But global research has proven over and over that there's a direct link or relationship between mental health and substance misuse and abuse. So, yes, there is a link, but locally I can't really speak to, at this time, our local situation, but globally, the research across the board that there's evidence, there's definite link. What you find is persons with mental health often use substances to cope with their challenges, whether it is that they're not aware of where services or support can be offered, or sometimes the substance use exacerbates some sort of underlying challenge that individual may have had before that never really came up. We're not saying one causes the other, but there's definitely evidence that proves that there's some relationship there between mental health and substance abuse.
And Mr. Chair, if I can come back to you and refer once again to your post as a law enforcement officer. Of course, in relation to the link between the mental health and the stress, there's also that aspect of the work stress that could link to it as well too. Can you speak to, in terms of what policies that there are within the law enforcement to help the officers who deal with very high stress jobs and see things that most persons may not be able to quote unquote stomach, and what is being done to help to educate the persons, the men and women within the agency, and to warn them about the dangers of any sort of substance abuse?
Yeah, okay, thank you for that question again. I first would like to say at present we don't have psychologists that would add to treatment for our people who goes through the specific stress. But what we do, we try to balance work, rest time, and have education within the organization to help them cope with the atrocities during the daily work field. Because what we find is that being shortage in our human resources forced our law enforcers to be overworked. And the challenges of the country itself, where we have lots of events, for example, the tourist season is upon us and it would require a lot from us. And if we don't balance that rest time, vacation time, and work, we would find our people being challenging and they would come up with mental health issues. So our commissioner and high command, we are working assiduously to get our specific, our own psychologists so that we could have constant meetings, dialogues, and treatment, so to speak, in person, so that we could be a better and stronger police force.
And of course, Mrs. Caines, for persons who may be abusing that substance and they want to make that change, rehabilitation is important. Any linkages with any regional or international organizations that help support that effort?
Yeah, so as I stated earlier, we do not have a formalized rehabilitation here, but there are rehabilitation programs in St. Lucia. I know we have one there. I believe Barbados. Ministry of Health is the main contact for that referral. And so if there is someone who needs that rehabilitation service, the Ministry of Health will have the information for the necessary contact and follow through that will be needed in that area. But outside of that, though, when we look at recovery for persons who may have a challenge, substance misuse and abuse, mental health, or both, simple things can help. There's the National Counseling Center as well. Speaking to someone you trust who can offer you that positive influence, that spiritual and social support is very important in recovery. Having strong family support and friendships often helps with the recovery as well. Being there for a friend, you see someone down, how can you support? There's this new slogan that I just can't grasp in my head. If you don't check for me, I ain't gonna check for you. Suppose we are good friends, right? I'm going through something, so I may somewhat isolate to try and deal. So I'm not expecting my friend to reach out to me. And it's a mindset that we need to change because we need to be there for each other. So these are simple things. Being a part of a spiritual, a church group to get that type of positive information and various social supports can help and go a long way in recovery.
Okay, and final questions. And Mr. Rogers, I'll probably come to you first, and then we'll end off with Mrs. Byron-Caines. What's your message to the public, to citizens here and residents in St. Kitts-Nevis, and how they can contribute in building a drug-free society?
Okay, thank you. And it's critically important. I jot down a few points here, and only about 2 or 3. We're asking our people, our citizens, and visitors alike to adhere to the various laws that we have put in place. Because if you adhering to our laws, you will find that we're a cleaner society. And another, I will asking for our people, citizens plays a critical role in our development and in our education. And so we're saying, spread the word around to your friends, your family, your children, because it starts there in your household. And if we see this happening, we should see a better nation, a better St. Kitts-Nevis. And yes, those are 2 basic things I just want to say before.
All right, thank you so much for this opportunity. I just want to share that each of us, we have a role to play. Each of us has a role to play. Be informed, support prevention efforts, connect with us as the National Council on Drug Abuse Prevention through our social media platforms on Facebook and on Instagram. And just be mindful, be responsible, and support each other as we continue to do our efforts to make St. Kitts-Nevis a more resilient nation.
Mrs. Karimu Byron-Caines, the Director of the National Council on Drug Abuse Prevention Secretariat, and Travis Rogers, Chairman of the National Council on Drug Abuse Prevention. Thank you so much for being with us today for InFocus.
Thank you so much for having us.
We'd like to thank you, viewers and listeners as well, for joining us. We trust that you will join us next week at the same place, at the same time, for another edition of InFocus. Remember, it's your government, your business. I'm Ian Richards.
Join us every Wednesday for InFocus, a weekly talk show produced by the St. Kitts-Nevis Information Service, where we provide exclusives with key persons within the government and discuss pertinent, relevant, and interesting matters that affect us all. Tune in every Wednesday, live on ZIZ Radio and streamed live on Facebook at SKNIS Media and ZIZ Online. InFocus, your government, your business.